J-Beam, and welcome to Equality Labs. We're in this together, a community health guide to understanding the coronavirus.
What is coronavirus? The 2019 novel coronavirus, or COVID-19, is a new respiratory virus that has not been previously identified. It belongs to a broad family of viruses named coronaviruses. How does coronavirus spread? Through airborne respiratory droplets released by an infected person's cough or sneeze, or through physical contact with someone who is infected or a carrier of the virus. The virus can also enter your mouth, nose, and eyes if you touch the same object or surface as someone infected and then touch your face.
How else can you protect yourself? Try avoiding contact. Avoid close contact with people who are sick by staying at least 2 meters or 6 feet apart. You can wash your hands. Wash your hands often with soap and water for at least 20 seconds.
These are the steps to properly wash your hands. 1. Apply soap or hand sanitizer to wet hands. 2. Rub hands palm to palm. 3. Rub hands palm to backside and switch. 4. Interlace fingers and rub hands palm to palm. 5. Rub backs of fingers into the opposing palm with fingers interlocked. 6. Grasp thumb in the other hand and rub while rotating around the thumb. Repeat with the other thumb. 7. Rub fingernails, including the thumb, into the opposing palm and repeat. 8. If using soap, rinse off with water and turn off the faucet with a clean towel. If using hand sanitizer, once hands are dry, they are safe.
Another way you can protect yourself is by not touching your face. Avoid touching your eyes, nose, mouth with unwashed hands. You can also protect yourself by cleaning and disinfecting. Clean and disinfect frequently touched objects and surfaces.
Watch for symptoms. Patients with COVID-19 have experienced mild to severe respiratory illness, including fever, cough, and shortness of breath. These symptoms can appear 2 to 14 days after exposure.
Get medical attention immediately if you have one or more of the following symptoms: trouble breathing, persistent pain or pressure in the chest, confusion or inability to wake up, bluish lips or face, or high fever.
What does physical distancing do? It breaks the chain. The more space between you and others, the harder it is for the virus to spread. Physical distancing lowers the pace and the extent of the spread of the virus.
Is prevention effective? Learning from previous pandemics, early and rapid implementation of distancing can significantly reduce the spread of infection and lower death rates. The goal is to flatten the curve and continually reduce the amount of cases.
Isolation, quarantine, and physical distancing. Isolation separates sick people with an infectious disease from people who are not sick. Quarantine separates and restricts the movement of people who were exposed to an infectious disease to see if they become sick. Physical distancing requires the creation of a physical space between individuals who may spread certain infectious diseases.
I'm healthy. Why should I care? You may have less risk personally, but taking such steps benefits the whole of society. A person who is not very ill can still infect others, including their parents, children, neighbors, and even people traveling in the bus. That is why it is up to each and every one of us to flatten the curve and shorten the length of this pandemic together. Solidarity, not charity. We need all of us to defeat this pandemic. Many of our people are without food, water, ways home, and even shelter. This is why it's important to keep connected even in isolation. Community networks are coming together to protect neighbors during this coronavirus pandemic. Stay tuned for advocacy asks because we need to see this as a moment of solidarity and health for all.